I'll tell you, my students are goated. I just learned that word. Yes, so one of my students told me one day, "Prof, you're goated," and I had no reaction. I went and Googled it, and I realized it is slang for talented.
What did you think it was before you knew?
Oh, I thought, they know I grew up with goats in the village. My name is Erta Cenko. I'm in the Department of Epidemiology, and I am a clinical assistant professor there.
So first question, what's your go-to drink order?
Oh, just a black coffee with some milk, actually.
If you could instantly learn any new skill, what would it be?
I had learned to play guitar.
Yeah?
And I tried some time back, 2 or 3 years, I even got a guitar. I haven't learned a chord.
Where do you get your fashion inspiration?
This blazer, I'll tell you a story about it. One of the other faculty asked me, "Where do you get this?" And I told her the name of the shop. She said, "Oh, that's where my mother-in-law shops." So I don't know if I am fit to talk about my fashion inspiration, but the good part, I get it from my mom.
What surprised you most going from Albania to the US?
Oh, I'll tell you something that has nothing to do with the academia or scientific part, but my image of US was just from movies and TV shows, and those are usually located in cities like New York City, LA. So when I came to Gainesville, I was like, where are the skyscrapers? I was lied at. Of course, I love it. I decided to stay and I don't see myself living elsewhere, but that was my first thought.
What motivated you to pursue a career in epidemiology initially, and how has that passion evolved over time?
So initially I studied public health. Public health is my first love. And while working in public health, I realized that epidemiology is kind of the backbone of public health. For example, without data about the distribution of disease, you cannot prevent it, you cannot create campaigns for health promotion, you cannot design health policy, all of it. That passion has evolved and become stronger, and as you can see, I am completely biased about the importance of epidemiology.
Some of your research includes using wearable technology to facilitate health interventions among older adults. So are there any interactions that you've had with a research participant that'll stick with you?
There are so many, but I'll tell you about a funny one. So in one of the studies, we do a 400-meter walk, and I had this 84-year-old participant. As always, I was telling him, "Okay, walk at your normal pace, do not overexert yourself, and I will walk behind you for safety." And then I started the timer, and he started walking the fastest I have ever seen. So by the third lap, I was practically wheezing trying to keep up. It was humbling. I immediately regret telling you this story that bruised my ego, but yeah, it still makes me smile when I think about it.
Part of your course profile includes undergraduate classes like Intro to Public Health and Survey of Diseases and Disability. So what's your favorite part of teaching undergraduate courses?
It is something that I see it with graduate students, but not as much. That moment when the light bulb goes on and they have this aha moment, they connect the dots when they understand a new concept. So that is really fun. And my favorite part of the semester is the last week. I always ask the students to write about the most interesting thing they have learned. It is so fulfilling to see all their responses and see how much they've learned. It is very cheesy, but sometimes I print my favorites for my teaching inspiration board, so yeah.
That's so cute. So you have like an inspiration, like a mood board kind of?
Yes, it keeps me motivated. I have some evaluations, some messages that students send me, and some really cool things they have learned.
What's one piece of advice that you'd like to give your students?
I want to tell them to stay curious and do not be afraid to ask questions. There are no questions that are not as important. There are no questions that are not as smart. Every time you ask a question, you learn something. So that's my advice for them.
Anything that you'd like to add before we close it out?
I will tell you a joke.
I'd love to hear it.
So, do you know why public health reports are always so optimistic?
Why?
because there are a lot of positive cases.
Oh my goodness.
I tell students that jokes sometimes, and I can't see them cringe so hard.
Well, thank you so much.
Thank you.